Hi and welcome to our channel where we answer some of the most asked health related questions. Today we are looking at some of the best ways to cure hiccups. What are hiccups? Hiccups are a common occurrence that can happen to anyone at any age. They are characterized by a sudden contraction of the diaphragm followed by the closure of the vocal cords, which results in the familiar hic sound. While hiccups may seem like a minor inconvenience, they can be quite frustrating and even last for extended periods of time. The diaphragm is a large, dome-shaped muscle that separates the chest from the abdomen. It plays a vital role in breathing as it contracts and relaxes to help draw air into and out of the lungs. The vagus nerve helps to control the muscles of the diaphragm, enabling them to contract and relax in a coordinated way during breathing. Let's look at what causes hiccups. There are several potential causes of hiccups. Number 1. Eating or drinking too quickly. Swallowing too much air while eating or drinking can cause hiccups. This is because the extra air can irritate the diaphragm, leading to hiccups. It is important to eat slowly and thoroughly chew your food. This will help to reduce the amount of air being swallowed and will also aid in digestion. Number 2. Digestive problems. Certain digestive problems, such as acid reflux or an irritation in the esophagus, can cause hiccups. As acid rises in reflux, it will begin to burn and irritate the esophagus, causing it to spasm. Swelling and inflammation of the esophagus will put pressure on the diaphragm, leading to hiccups. Next is medications. It is not fully understood why some medications can cause hiccups, but some medications such as opiate, painkillers, and sedative can cause hiccups as a side effect. Opioids and sedative may cause hiccups by depressing the respiratory center in the brain, leading to shallow breathing and hiccups. Chemotherapy drugs may cause hiccups by damaging the nerves that control the diaphragm. Antidepressants, heartburn medications, and corticosteroids may cause hiccups by affecting the muscles of the esophagus or the balance of chemicals in the body. Next is alcohol and smoking. Alcohol or tobacco use. Consuming a large amount of alcohol or using tobacco products can irritate the diaphragm and cause hiccups. Emotional stress, excitement, or nervousness can cause the diaphragm to contract, leading to hiccups. Swallowing air. Hiccups can be caused by swallowing air, which can occur when taking, talking, chewing gums, or eating too quickly. The best 8 ways to cure hiccups. Hiccups are a common occurrence that can be annoying and even embarrassing, but they are usually not a cause for concern. Most hiccup goes away on their own after a few minutes, but if they persist or are disrupting your daily activities, there are a few simple remedies you can try to get rid of them. Number 1. Drink a glass of water. Drinking a glass of water can help to stop hiccups because it helps to stimulate the swallowing reflex, which can interrupt the hiccups reflex arch. By interrupting the hiccup reflex, it allows for the diaphragm to stop spasming and calm down. Number 2. Hold your breath. Try taking a deep breath and holding it for as long as you can. This can help to relax the diaphragm and stop the hiccups. Holding your breath may help to stop hiccups by increasing the amount of carbon dioxide in your bloodstream. When you hold your breath, you exhale less carbon dioxide than you normally would, which can lead to an increase in carbon dioxide in the bloodstream. This increase in carbon dioxide can stimulate certain nerves in the diaphragm, which may help to interrupt the hiccup reflex. Number 3. Swallow a teaspoon of sugar. Swallowing a teaspoon of sugar can help to stop hiccups because it stimulates the vagus nerve, which can interrupt the hiccup reflex. The vagus nerve is a long, complex nerve that runs from the brainstem down through the neck, chest, and abdomen. It is involved in many important functions in the body, including controlling the muscles of the diaphragm. In addition to controlling the diaphragm, the vagus nerve is also involved in controlling the muscle of the larynx, which is the voice box, the pharynx, which is the throat. It is also involved in the regulation of heart rate, blood pressure, and digestion. Next, bite on a lemon or drink lemon juice. The sour taste of lemon can stimulate the nerves in the mouth and throat, which can help to stop hiccups. There are a few different theories about how lemon juice may help to stop hiccups. One theory is that the sour taste of lemon juice stimulates the muscles in the throat and the diaphragm, which can help to interrupt the hiccup reflex. Another theory is that the acidity of lemon juice helps to stimulate the nerve in the throat, which may help to stop hiccups. While lemon juice may help to stop hiccups in some people, there is no scientific evidence to support its effectiveness. Next, drink a glass of cold water. Drinking a glass of cold water can help to stop hiccups because the cold temperature can stimulate the nerves in the throat and interrupt the hiccups reflex arch. Next, pull on your tongue. Gently pulling on your tongue can stimulate the nerves in the throat and help to stop hiccups. Pulling on your tongue can stimulate the muscles and nerves in the throat and the diaphragm, which can help to interrupt the hiccup reflex. Next, gargle with water. Gargling with water can help to stop hiccups because it stimulates the nerve in the throat and can interrupt the hiccup reflex arch. Next, eat a spoonful of peanut butter. Eating a spoonful of peanut butter can help to stop hiccups because the texture can stimulate the throat and interrupt the hiccup reflex. It is possible that the act of chewing and swallowing the peanut butter or any other food that has the same smooth, thick, and dry texture may help to stop hiccups. This is because swallowing this requires the contraction of the muscles in the pharynx and larynx, which can help to reset the diaphragm and stop hiccups. In summary, if these remedies do not work and your hiccups persist for more than 48 hours, it is a good idea to see a doctor. Persistent hiccups may be a sign for an underlying medical condition and can cause dehydration if they prevent you from eating and drinking. Thank you for watching. If you enjoyed this content, please be sure to give this video a like and subscribe to our channel for more.